The people getting sick now include the very people sent in to stop it. Responder infections are climbing, and that changes the math on everything. If you're just catching up, the Bundibugyo outbreak was declared in Ituri on May 15. Before today's reports, it had reached 1,873 confirmed cases and 672 deaths across 5 areas: Ituri, North Kivu, South Kivu, Haut-Uele, and Shopo. The 2 newest areas are tied back to Ituri through contacts and population movement.
This is Ebola Watch, and today it's being called the fastest-growing outbreak in history. A rebel faction starts declaring its own territory Ebola-free, and Oxford launches a first-ever trial. We start with the responders. We'll keep tracking DRC Bundibugyo Ebola outbreak. Follow the show so the next update finds you.
From Stephanie Souchere at Africa Business Insight.
As of 9 July 2026, 112 health workers had been infected with Bundibugyo virus across DRC since the outbreak began, including 35 who died. The confirmed infection of a U.S. humanitarian worker supporting the response in Bunia adds urgency to the protection of everyone working to contain the outbreak.
Africa CDC put a hard number yesterday on what this response is costing the people doing it. 112 health workers infected with Bundibugyo virus since the outbreak began, 35 of them dead. Those are confirmed infections, and Dr. Jean Kaseya spelled them out directly.
And one of those 112 is now a U.S. humanitarian worker in Bunia. That's the detail that makes a Peace Corps parent sit up. An American doing the work, exposed.
Kaseya's list is specific. Reliable PPE, infection prevention systems, continuous training, psychosocial support. I'm wondering whether that's new policy or just a restatement of what should already be standard 8 weeks in.
Right, because when a Red Cross volunteer gets attacked with a spade and workers walk off over unpaid wages, a call for stronger protection has to mean money and equipment on the ground, not a press release honoring the dead.
From WTOP News.
The Ebola outbreak in eastern Congo is now the fastest-growing one in history, and new challenges keep emerging even as work begins on a study of 2 badly needed treatments for a type of Ebola that currently has none. A strike this week by unpaid workers at an Ebola treatment center at the heart of the outbreak could light the flame for others in a remote region already suffering from bare-bones infrastructure, rebel threats, and misinformation asserting that the deadly virus isn't real.
Fastest-growing Ebola outbreak in history. That's the AP's word, history. And there's a number under it now. Nearly 2,000 confirmed cases, 702 deaths.
Confirmed. And that qualifier matters more than usual today, because suspected cases are now popping up in 2 more provinces, including Kisangani, one of Congo's largest cities.
So the responders themselves don't know how far it's spread yet.
They don't. AP says it was missed for weeks. They were testing for a more common type of Ebola, and the origin is still unknown. When the case count keeps moving and the map still has blank spots, fastest growing lands hard.
And on top of that, a strike this week. Unpaid workers walking off the job at an Ebola treatment center at the heart of the outbreak. That's exactly how the flame catches.
From Oxford Vaccine Group.
To support the rapid launch of the study and progression of the vaccine candidate into clinical evaluation, Serum Institute of India, SII, has manufactured and stockpiled approximately 620,000 doses of the ChAdOx1 BDBV vaccine candidate in 2 weeks for potential future use, and has supplied 4,000 investigational doses for this Phase I trial.
Okay, this one I've been waiting on. All week we kept saying there's no licensed vaccine for this exact strain. And now Oxford's launched the first ever human trial for a Bundibugyo shot.
It's real progress, but let's be precise about what it is. BD-EBOV is Phase I, 50 healthy adults ages 18 to 55 in Oxford, looking at safety and immune response. So for now, it's an early pipeline test. No shipment to Bunya yet.
But here's what got my attention. The Serum Institute of India has already manufactured and stockpiled about 620,000 doses before the trials even read out. That's a big bet before you have the safety data.
It's manufacturing at risk, which tells you how urgent that pipeline gap is. But I want to keep the distinction clean for people. Doses in a factory in India are not the same thing as an approved vaccine, and Phase I safety data is months, not days. Here's Clement Bonnereau at the Star.
Congo's AFC M23 rebels have used a small Ebola outbreak in territory they control to showcase their ability to govern, mounting a response largely separate from authorities in Kinshasa and supported in part by neighboring Rwanda, according to response teams and official documents.
So, a rebel group holds a press conference to say the Ebola outbreak in its territory is over. And that same day, the mayor of Goma, who's under that same rebel group's control, bans public gatherings because of Ebola risk. Same geography, opposite messages.
That contradiction matters, Daniel. When contact tracing crosses a line where one authority says, all clear, and another says, lock it down, you lose the shared case definition containment depends on.
Freddie Kaniki, the AFC/M23 deputy coordinator, is framing this as governing credentials. A public health emergency as a resume line.
Reuters reviewed health ministry documents and spoke with 8 sources. This is a parallel response, backed in part by Rwanda, running separate from Kinshasa. All week, I've called cross-border coordination a disease control variable. This is what it looks like when the border moves inside the country.
And declared over means what, exactly, when the wider outbreak is being called the fastest growing in history? You can't declare your corner clean while the room next door is filling up.
If Ebola Watch helps you stay grounded in outbreak news, try Measles Outbreak Daily. It's daily U.S. measles case counts, MMR vaccine policy, and outbreak tracking for parents, teachers, and clinicians who want real numbers. Find it wherever you listen to podcasts. Next, we're watching the exposure investigation and contact tracing around the infected U.S. humanitarian worker in Bunya. We're also watching Oxford volunteers move from screening into vaccination and follow-up, pending regulatory review, and the assessments of suspected cases in 2 additional provinces, including Kisangani. As always, links to every story we covered are in the show notes, so you can dig into anything you want to follow more closely. That's Ebola Watch for today. This is a Lantern podcast.